My name is Jason Lofton. I am a family physician or general practitioner in Southwest Arkansas in the United States. I've been in practice for 13 years in private practice, actually. So I have a clinic-based practice. I live in a county of 17,000 people. Our first case was around March 20th, and it took us 30 days to get the first 10 people. The next 10 people took 15 days. The next 10 took 7, and now we're seeing on average of 20 a day. Most of what we're seeing is actually not, people aren't that sick. It's a lot of contact tracing. We have a large poultry, 2 poultry industries in the area, 3 actually in the area. And so that's the majority of our cases right now are within those industries. These people work close together. And we have a large Latino community and actually a Marshallese community. So people from the Marshall Islands, which is a South Pacific nation, live here as well. And so those communities actually interact very tight-knitly, and that's what we're seeing. I think the spread is because of the close interaction that a lot of these people have with each other at work and at home. But thankfully, the majority of the people are not very sick. Out of 500 positive cases, we've had 5 deaths. 4 of those have been in people who had comorbid conditions. 1 was in a healthy 50-year-old lady who had no problems whatsoever. And so that's the interesting part of COVID-19 is from my perspective, are the people who shouldn't die based off of how this is similar to the flu in some ways, but it's not, in that these people that are dying that shouldn't die, that's what I find very interesting in this. I personally wonder if this isn't genetically related. That someday we can look back and see certain genetics allow people to be more susceptible. That's what my hunch is, because we have no way to explain how some people die and some people, we've had 70 and 80-year-old patients that do fine and a 50-year-old patient who didn't. So that's what I find interesting from a physician standpoint. I'm also a part of a nonprofit, and we got a grant to have material, and we passed this material out and had masks made. So we've had over 1,000 masks made in the local community. But so that's one of the, I guess, my pet peeves, or you could call it stickler points. I don't see very many people in our community wearing masks. I believe it's because for so long we heard about coronavirus, but nobody knew anybody who had it, and our wave is just now hitting. So being in rural Arkansas, we tend to not see the flu. You'll see it in the East Coast and Houston, LA, areas that have international travel. We'll see it there first, and then it hits here later in the year. So it's just now hitting us. And I think people just got complacent because for so long they heard about this virus, and nobody was aware of it in our county for 2 months or so. And then still today, you would ask a lot of people, do you personally know someone with it? And a lot of people couldn't name someone that they know with it. And so I think that's part of the reason people they got tired, they got complacent. So there's a lot of grants right now for nonprofits, at least, to try to get some resources to help, whether it be education or buying material for mask making, which I do believe works. The data is more and more coming out saying if we would wear masks, which is no different than somebody covering their mouth. We tell people, during flu season, cover your mouth, cough into your elbow, wash your hands. If we would just do that, I believe we could help limit the spread. We do need herd immunity for this to slow down. So, a vaccine coming along the way, if it's properly vetted and not rushed, that would be some concern of mine, is a vaccine being rushed through too fast. I'm a big proponent of vaccines. I do believe they work. I believe in them. And so that would be something I want to see, is that the vaccine is effective and not causing problems, because that's not going to help our vaccine education. There's a company that rushed process through, and it killed some people, and it was a setback for some of the polio vaccines. So the live polio vaccine that we see now is the oral vaccine. It's given in most of the developing countries. That one was able to rise to the top because of the vaccine that had problems back in, I think it's the 1950s. And so my current view on the mask is, I believe I would love to see a nationwide mask mandate. I know people don't like that, but I do believe that. Right now, our availability of PPE is I have what I need for the moment. My concern would be if we have a larger wave in the fall, which is a concern of mine, because if schools go back, which I believe they will, and shifting to that data, there's not a lot of data supporting the transmission rate among kids. And so I think it would be okay for school to start back. Kids need education, they need community. And I don't believe staying at home is very effective, especially in a rural area like mine, where there's not a lot of internet availability to everyone, and the cell phone coverage is not very good as well. So that's a little sidetrack there. But so I have a concern there for the availability of PPE. I am a part of what's called a ACO, Accountable Care Organization, through Allidaid, and they have been able to help resource some PPE to me. So it's a group of physicians who come together to try to help save overall cost, and they have been a great resource to me personally as a solo provider. I think a lot of doctors in at least the United States that have access to ACO would benefit from what I've benefited from. My general advice to the public on how to weather the storm, one, is to stay calm. This is going to be with us at least for another year or two. If this virus mutates, it's going to be with us for a long time. We have to look at how do we still interact with and go on about our lives without being locked down by fear or locked down by this, because fear alone, I'm afraid, fear can cause the body to respond. It can, if you live in fear, I think your immune system can get worn down. We have to be able to go about life without this fear of this thing taking over us, but still take proper precautions. I think that's in our community. That's the biggest thing I've tried to promote is not to let this thing take over our life from a fear standpoint. And there's still a lot of people who are staying home. I mean, I think older patients that are at higher risk, or it's probably wise to stay home. You can stay home, but not be locked down by fear in this. You can take precautions and not let this take over your life from a fear-based standpoint. And that is something I really try to communicate to my local community. And I'm encouraging people to get out and exercise, to eat healthy, get good sleep, those types of things. I'm outdoors. I like to ride. I'm a cyclist, and I like to ride my bicycle, and I can do that alone. I can do that even in groups with my family, and we can stay far enough apart that we're not giving this virus to each other. And so getting out in nature, taking bike rides, hikes, walks, get out and do that stuff. You can walk around your neighborhood and you're not going to get infected. And those are the types of things I think people need to do to stay healthy. I'm going to promote that whether there's a virus or not. Opening, my biggest concern is that people see this as a political thing in the United States, at least. It's looked at, I hear people thinking it's a hoax, people that think it's coming from the left, or some people think, the right. We're seeing a big division within the United States right now. And so one of my bigger concerns is people thinking this is a political thing when it's a virus. And we've had viruses like this all throughout history. And so I guess I would want people to take it seriously and just look at also value other people's lives. If I've seen people say, well, you're not going to make me wear a mask. And that's, to me, I want people just to consider that 70 or 80-year-old person. And by wearing a mask, that might help stop you from transmitting the virus unknowingly, because most of what we're seeing, at least where I live, are people who are asymptomatic carriers. And I've just saw people this week who had no known exposure, had no known symptoms, but because of their work environment has had potential exposure, they got tested and they're positive. And that's probably the majority of what I've actually seen in my practice. So I would want people just to consider wearing a mask. If there was one thing if I was president of the United States, I would ask people to wear a mask, and I would wear a mask myself. So personal story, in March, I had a mild sinus infection myself. did not meet the criteria to get tested for COVID-19 and had 2 or 3 days of decreased taste. And so that was coming out that the virus caused decreased taste. It's called anosmia. And a couple weeks later, one of my daughters had the same thing. And we all have allergies in our family. And so we kind of wrote it off to allergies. But when the antibody test came out, I did the antibody test, and myself and my daughter, who had similar symptoms, came up positive for the antibody, meaning that was most likely the virus that we had. Now, I had never had fever. I never had shortness of breath. I never had a cough, even other than maybe a little drainage. Was not sick at all. Other than it was nothing I would have gone to a doctor myself for. And so my wife and my other 3 children did not have antibodies. Now, we don't know if those antibodies mean that I'm protected in the future. All we know is that means that I had the virus. And I did double check with another lab to make sure that was not a false positive. And it was not. So most of us, it's survivable. I'd say majority of us, if we get it, that's one reason not to fear, because majority of us are get it, and it's not going to be much more than a common cold, which is that is causing a problem with people taking it seriously, because for most of it, it is not that bad. It's for those people that we don't know that are going to die from this, and that's what we're trying to deal with, is how do we protect the public without maybe impacting our lives. I mean, I understand the finances of needing to work. I have a private practice, meaning if I don't see patients, I'm not getting paid. And so I understand the finances behind it and the need to work. And yet at the same time, I understand the value of life. And so we're going to have to, adjust. It may mean doing visits over the phone, or I'm appreciative in the United States, at least we're able to do telemedicine for most of our patients. Again, in a rural area, I have patients who don't even have a cell phone. They may have an old flip phone, or maybe not have a cell phone at all, or maybe they live in an area that doesn't have broadband internet. And so I would like to see that expanded within my own practice. So for instance, we have some patients who have Samsung phones, and we've had extreme difficulty with a Samsung phone connecting to our telemedicine portal. So we're buying a Samsung phone for our practice just so we can connect to these patients with Samsung phones. And so we're making our own adjustments to how do we connect with people, because if this continues to grow in the fall, which I think it will, I'm going to try to do more telemedicine visits with my patients to keep them from having to leave their house. We've made adjustments within our clinic. If somebody has symptoms, we will not see them in the clinic. We actually we have them park right outside the clinic, and we come outside to the patient and see them as work on a curbside visit. Or we do the telemedicine visit and have somebody come out to them in their car, and we'll swab their nose for the coronavirus. We may even draw their blood. If they're not sick, they just don't want to come into the clinic. And so we're trying to limit the number of people who come in that potentially have symptoms. We're screening people, and we're wearing masks. I wear a mask every day, even though my antibody test says that I've had the virus. I still wear a mask, one, because that's a message I want to promote to my constituents, or the patients. And then I'm the county health officer in this area, meaning it's an appointed position that I have from the county judge, and I'm the liaison or the contact person for the Arkansas Department of Health. And so I'm promoting the message that please wear masks and help to socially distance as much as possible. So I'm trying to promote that message myself just by wearing a mask, and my whole staff wears a mask. Yeah, I do see telemedicine being important at least in the age of this infectious virus. It's actually so in a rural area, I might have patients travel 20, 30 minutes just to get to my office. And if they're not sick and they just need a checkup visit to check on how they're doing, maybe refills of medicine, before they could even be halfway to my office, I could already have done a telemedicine visit with them. And they're finding, a lot of patients are finding they enjoy doing that from home. Not everybody does. And so we're making it available to people and encouraging them to use that. But also we still see people in the office. And I enjoy both. I mean, I like to talk, and I'm conversing with my patients beyond medicine. I'll ask them how their garden's doing, or how their grandkids are doing, or how their trip went. And so, but it's been neat for me to kind of see people in their home environment. And I do home visits. It's limited because of travel time, but it in some ways feels like I'm getting to do a home visit. And so, but I do see that growing, especially with this virus and potential future viruses or future outbreaks. So I would love to see, from a policy standpoint, I'd love to see insurers pay full price. They do right now, but before this, they did not. So most physicians didn't utilize it. And even on the weekends, I've been able to do telemedicine visits with patients. I'm not in the office, but I can still do a visit with them and get a medicine sent in and maybe avoid a hospital or ER visit. So I think it can be important. And we do have to be careful that we're not missing something by a telemedicine visit. So it'd be easy to miss a diagnosis. So there's certain patients I will say, hey, you probably need to come in for that. Let me listen, or let me feel your stomach. So that's a caution there, but I do see it helping. So typically when we get infected with, whether it be a virus or a bacteria, virus and bacteria, different, a virus is an illness we get that an antibiotic will not treat. HIV is a virus, the flu is a virus, polio is a virus. Then you have bacterial infections, which antibiotics treat. So your urinary tract infections and certain types of pneumonia and staph infections or skin infections. So but when we get infected, our body will make antibodies to fight that virus. And over time, ideally, we make enough antibodies so that if we get in contact with the same virus again, we already have a defense mechanism in place so that we don't get sick again. Now, the influenza virus changes on a yearly basis. And so that's why we continually have to take a new flu vaccine or get sick with the flu again. If the flu never changed, we would not get sick again. So our hope with the coronavirus would be that it does not mutate, although we have seen certain mutations in certain countries. If it doesn't mutate dramatically, then this will be over once a certain percentage of people either get vaccinated or get the virus, which would achieve herd immunity. Our concern would be if it continually mutates, then our current antibodies that my body has made to fight what I was infected with would be ineffective at the next mutation. And so we don't know enough data yet to know even myself, does that mean I'm immune to the coronavirus this fall? I hope. It would mean as a physician, I could go to a hotspot in New York or Miami or LA and help and not have to worry about dying or getting infected from it. But we don't know that yet. And so the only data that antibody tells me is, yes, I had it previously. And I will say that we tested quite a few patients for the antibodies that thought they had it. I saw a large number of patients this January and February who had what we term as influenza-like illness, meaning they tested negative for the flu, but they had body aches, fever, headache, chills, cough, what sounds like coronavirus. And I was thinking I was going to see a lot of positives, and I have not actually. I had 2 or 3 rounds of that myself. So there was another virus going around this winter. I think I saw we're about 30% of the viruses that go around every year. We really don't even know what they are, but most of them are very mild. And so for antibodies, it's what our body makes to fight infection, and they stay with us for life. And so we can measure those and see whether we have a low response or a high response. And right now, it's just too early to know what that means for the coronavirus itself. But an asymptomatic person would be a person who really has no symptoms, but they are spreading the virus. And there's still some ambiguity on what that actually means. I saw the World Health Organization just had a report saying that they saw very few evidence of asymptomatic carriers, but locally, I feel like we're seeing a high percentage of that. It could be that my patients are just minimizing their symptoms out of fear of having the virus. And so, but it would be somebody who has no fever, no cough, no shortness of breath, and they're walking around spreading the virus. And that can happen. Some people may not be symptomatic for 7 to 10 days. And so that if you get infected on a Monday, you can start shedding the virus within 2 to 3 days, and it might be the next Monday before you develop symptoms. And so sometime within that week period, you're going to be an asymptomatic carrier, meaning you're spreading the virus unknowingly. And that's where the mask would come in. If you wear a mask during that time, you can limit your spread. Maybe not 100%, but if you limit it 50%, you're going to reduce half the people getting infected.